Assalamu alaikum. My name is Varda Dost and my roll number is BP 1650249, and I will be presenting on the topic Lumefantrine, and I will be discussing the drug Lumefantrine. So Lumefantrine is an anti-malarial medication that interferes with the growth of parasites in the red blood cells of the human body. Malaria is caused by parasites that enter the body through the bite of a mosquito. Malaria is common in areas such as Africa, South America, and Southern Asia. Lumefantrine is a combination medicine used to treat non-severe malaria. Lumefantrine is basically is used in combination with artemether. So indications: artemether, lumefantrine, they are usually used in combination and is indicated for the treatment of uncomplicated P. falciparum malaria, including multi-drug resistant strain. It is also effective against the blood stage of P. vivax, but not active against hypnozoites. Pharmacology and pharmacodynamics. Both artemether and lumefantrine inhibit nucleic acid and protein synthesis. In the body, artemether is metabolized into the active metabolite dihydroartemisinin. The drug works against the erythrocytic stages of falciparum by inhibiting nucleic acid and protein synthesis. Artemether is administered in combination with lumefantrine for improved efficacy. Artemether has a rapid onset of action and is rapidly cleared from the body. It is thought that artemether provides rapid symptomatic relief by reducing the number of malarial parasites. Lumefantrine has a much longer half-life and is believed to clear residual parasites. Now let's look into the drug interactions and side effects. Common side effects may include headache, dizziness, fever, cough, feeling weak or tiredness. Muscle pain, tenderness, or weakness is also seen very commonly. Joint pain, vomiting, or loss of appetite are very common side effects. Let's move on to the drug interactions. Some anti-malarial drugs, such as halofantrine, should not be used within 1 month of treatment with lumefantrine because drug interaction may occur. So such examples include as ketoconazole, some anti-seizure drugs such as carbamazepine, phenobarbital, phenytoin, also some antifungals azole derivatives such as ketoconazole, itraconazole, mefloquine, HIV, NNRTI such as delaverdine, efavirenz, HIV protease inhibitors such as nelfinavir, ritonavir, rifamycin such as rifabutin, rifampicin, St. John's wort, among others. So these drugs should not be used in combination with the anti-malarial drug lumefantrine because it can cause drug interaction. Also, this drug should not be used in pregnancy because it is not safe and we don't have much data available for its safety uh, profile. Irrational drug use. Irrational drug use is very common. Misuse is in the form of multiple repeated doses of this anti-malarial drug is very common in Nigeria and also other parts of the world. People usually take um, these medicines without knowing the proper dose and without knowing the side effects and consequences of using these drugs. The problem is mainly related to a lack of training and an absence of proper treatment guidelines and diagnostic facilities. Therefore, in areas where clinicians have no access to laboratory facilities, treatment is based mainly on clinical symptoms, which leads to overdiagnosis of malaria and excessive use of anti-malarial drugs. Now we have some alternative choices for lumefantrine. So first of all, we will look into ARCO. Generic name is artemisinin with a combination with naphthol-queen. Reason: if patient is not responding to lumefantrine or repeatedly vomiting the drug after administration, then this drug can be a choice of treatment. Second drug is Fansidar. The generic name is pyrimethamine with a combination of sulfadoxine. Patients having arrhythmias or other heart conditions should avoid lumefantrine. This combination of drug can be a choice of treatment. And the third drug, Malarone, the generic name is atovaquone with a combination of proguanil. This drug is also used with the same reason. Patients having arrhythmias or other conditions should avoid using lumefantrine. So this drug, Maleron, can also be a choice of treatment. Let's look into alternative brands with low and high price option. Here I have assembled the comparison between different pharmaceutics and the prices of different pharmaceutical industries. So we have Stan Farm, Searle Farm, Bloom Farm, Wood Watts Pharma, Star Pharma, and Getz Pharma. Here we can see that the highest price, and that is 82 rupees per tablet, is Woodward's Pharma, whereas the normal average price is 55 rupees per tablet. So for economical uses, we can choose. It's up to us that um, if you want to buy a cheaper option or a expensive one. Okay, now let's look into case study. So here we have a case of a male patient whose age is 46 years old, and his chief complaint is fever, vomiting, back pain, fatigue, headache for 3 days. Past medical history is he has diabetes mellitus and hypertension. When we took his personal history, this person is non-alcoholic and non-smoker. So now let's move on to the objective. We took his physical examination. Patient is conscious and temperature is 105 Fahrenheit. Blood pressure is 130 by 90 and pulse is 90 per minute. We also took some other tests such as dengue. So the dengue test came out negative. So by the symptoms and all these tests, the diagnosis is malaria. So now we have a plan of IV fluids for 2 days, capsule doxycycline 100 milligram per oral BD for 5 days. Tablet coartem, that is artemether with a combination of lumefantrine 650 milligram per oral TDS, that is 3 times a day for 1 day. Also, tablet chloroquine 600 milligram per oral OD 5 times a day. And also an injection emised 4 milligram IV stat, that is immediately for 2 days. So, this is the plan we have given for a malarial patient. We also have to do some patient counseling, that is take adequate rest, drink plenty of clean water, and an MQBC test, that is a test for malaria, is recommended after 14 days to check if the malaria is still in the body or not. So the references I have took these material from is pharmacotherapy case book, and also some online websites that are reliable, and I have prepared this presentation from. Thank you very much.